Welcome to the Kaiser Permanente San Diego Family Medicine Residency. We're located in Claremont Mesa, which is a suburb in the heart of San Diego. One of the most important parts of a family medicine residency is having a strong clinic-based experience, and our new medical home provides that great opportunity for our residents. More than 50,000 patients consider this building their medical home. One thing that's really important in our system is that patients identify who their primary care doctor is and that doctor follows them for most of their visits. Over 95% of patients in San Diego can identify who their primary care physician is. In addition to having our family medicine residency, this building also houses pediatrics, allergy, radiology, pharmacy, and a lab. 2/3 of the time when a patient is scheduled, they'll be seen by their own primary care physician. When our residents start residency, they're assigned their own panel of patients. They follow those patients throughout their 3 years of training. When the residents are on their hospital rotations, they still follow their patients. So they'll receive the labs and x-rays and everything and act on those. We have a system in place called Cortex, which is where we have one of our faculty member assigned to be available to our residents anytime. So if a resident has a question about their patients, they can ask that faculty member. So here we go into our new medical office building. We've tried to make our building as patient-friendly as possible. So one of the things that we have is an amazing check-in process. Patients can check in the night before their appointment on our app. They can check in at a mobile kiosk, or our great reception team is available to check people in at the desk here if they need help. So we just want to show you around the first floor. So we're just going to show you some things that we have on the first floor here. So we have optometry. And here's our lab. And down the hall to the right here is radiology. We're currently on the first floor here in pediatrics, and our residents have extra time where they come to pediatrics clinic. Our first and second year residents come to clinic here in pediatrics at least 1 half day per month, and third year residents come 2 half days per month. This pediatric department also houses the John Richards Learning Center, where they provide specialized care. When residents are in pediatric clinic, first year residents see 4 patients per half day, second year see 6 patients per half day, and third year residents see 8 patients per half day. There's a dedicated pediatrician who basically supervises and helps them in clinic, and they have protected time to teach. We're entering one of our 2 modules. Each module has about 15 exam rooms, and we're going to show you inside. This is our clinical dashboard, and this is how our team communicates with each other about when patients are ready to be seen by another team member. So our nursing staff will click on the board and tell us when our patients are ready to be seen, and if we need help, they can click on a different color on the board to tell us when we need extra help. Each exam room has a TV screen that we can use to share images like patient's recent x-ray, or if we want to give them educational information about exercises to do, we can show them on the screen here. Our exam tables are state-of-the-art. They can actually weigh patients while they're seated here. We also have a remote to help control everything in the room. Kaiser Permanente is known to be a world leader in prevention. One of the reasons for our success is our amazing nursing staff. Our nurses help us with outreach to patients to get their needed tests done, including cancer screening tests. Another reason for our success is our team-based care. We meet with our nursing staff at least once a month. We huddle with our team every morning, and our nursing staff are able to help patients get scheduled for needed appointments and provide them their vaccines even before we walk in the exam room. In San Diego, we have a Positive Choice and Center for Healthy Living departments. These departments help offer classes in weight management, smoking cessation, and education on many health topics. Some of our residents do electives in these departments. We have amazing help from our care managers for depression, diabetes, and population-based care. Now we're in one of our 2 residency precepting rooms. When our residents are in clinic, first-year residents start by seeing 3 patients per half day and go up to 5 patients per half day. Second-year residents see 6 to 8 patients per half day, and third-year residents see 8 to 10 patients per half day. We have 1 faculty member for every 2 first-year residents in clinic, and 1 faculty member for every 3 second or third-year residents in clinic. If you speak a language other than English, you will have patients on your panel who speak your language. In the past few years, we've had residents who speak to their patients in Spanish, in Polish, Russian, Vietnamese, and Mandarin. One of the highlights of our program is our patient-centered medical home rotation, where all of the first-year residents are together for the entire first 4 weeks of residency. They really get a great experience of getting a solid foundation in the clinic, and we also do a lot of community service activities during that month. In the past, we've done things like doing over 400 sports physicals in one morning. We're the officials for the Boys and Girls Club summer games, where 19 chapters of the Boys and Girls Club compete together in sports. We've done health fairs, and we help lead our Summer Urban Fellowship. The Summer Urban Fellowship is a 4-week pipeline program where we encourage high school students from underserved communities to go to college and pursue science-related careers. Every Wednesday afternoon, all of our first-year residents are in clinic together, regardless of their rotation. We start the afternoon with a chalk talk, which is a short lecture before clinic starts, and at the end of clinic, the residents kind of wrap up together, sharing interesting cases that they saw. First-year residents have 50 patients to 100 patients, second years have 200 to 300 patients, and third-year residents have about up to 500 patients on their panel. Our residency is divided into 3 smaller teams or pods. The pods are organized to cover each other when we're on vacation, to organize social events, and to work together on clinical strategic goals. We really embrace technology in our residency program. Both our residents and faculty communicate by email with patients. We also do phone and video visits, and we actually have a specialized training curriculum in telehealth. Our residents have extra specialty clinic half days that we call carve-out clinics. These carve-out clinics include pediatrics, gynecology procedures, geriatric assessment clinic, dermatology, minor surgery, and our Living Well clinic, which is our behavioral medicine clinic. During our gynecology clinic, our residents gain experience in insertion and removals of Nexplanon and IUDs, as well as perform endometrial biopsies. Through our OB centering program, our residents follow a group of pregnant women throughout their pregnancy and then deliver their babies. The patients get amazing continuity of care, and our residents gain great experience in group facilitation. Welcome to our consultation room. Every Thursday morning, our residents have a Living Well clinic with our behavioral medicine specialist. Residents have 1-hour appointments to counsel patients for anxiety or depression and to coach behavioral change. In geriatric assessment clinic, residents work one-to-one with a geriatrician, family medicine faculty, and have help from social workers, physical therapy, and a pharmacist to provide optimal care for patients with early dementia. In minor surgery clinic, residents have longer appointments to remove cysts and lipomas and to perform skin biopsies. So now we're going to show you where our providers have their offices, including our residents. So we're walking into what we call the enclave. We have a classroom for residents to get teaching. All of these kiosks here, is that the term you would use? All of these desks here are for our residents and nursing staff. And along the perimeter are our faculty offices. Every Friday afternoon, all of our residents have protected, dedicated time to formal teaching and education. We've tried to make the afternoons as interactive as possible by having educational games, workshops including suturing, IUD and subdermal implantation workshops, joint injections, and completing board exam questions together. We also have a monthly resident support group, quality review once a month, and journal club. I did my residency at a Kaiser Permanente residency because our organization is committed to balance great hands-on experience and formal teaching. Being a Kaiser Permanente physician is a great place to practice family medicine. 70% of Kaiser Permanente residents stay in our system when they graduate because they realize it's an excellent place to work and we provide exceptional care. I'm excited that you're visiting us today. I hope that this quick tour of our Family Medicine Center provides you some highlights of how our residents receive exceptional outpatient clinic training. I hope to see you again in July.